Welcome everyone. Today we're diving into chapters 5 and 6 of the Trail Guide to Movement. We'll be focusing entirely on joints for both of these chapters. We'll start with the fundamentals, planes of movement and axes, before moving into how we classify joints structurally and functionally. By the end of this unit, you should be comfortable defining ranges of motion and identifying the different types of synovial joints that allow our bodies to move. Here are unit terms that are important to look over for this chapter. You can pause the video in this section, but there will be more on them later. Again, more unit terms that will be going through this. As we begin, we'll be going over anatomic position, planes, axes, and movements. To understand movement, we first need a map, so we'll always start from the anatomic position. This slide is slightly scary, but it will help us remember what the anatomic position is. So starting from the anatomic position, the different planes of the body are sagittal, frontal, coronal, transverse, horizontal, and oblique. The sagittal plane divides us into left and right, and actions that are happening here are flexion and extension. Descriptive terms, medial and lateral. Of course, medial being closer to the body's midline, lateral being further away from that. There can be infinite sagittal planes, but only one mid-sagittal plane because that is the body's midline. A way to help remember this is the S in sagittal, and that would be splitting side to side. And the visual aid you could think of is an archer shooting a Sagittarius arrow. And to shoot the arrow, you stand in profile and the arrow path slices you into a left and right half. The frontal or coronal plane divides us into front and back. This is where we see adduction and abduction. And terms that we'll use here are anterior, meaning front, and posterior, meaning back. The trick with this, pretty simple. Frontal divides into front and back. That one is a little easier, but if you're looking at, if someone mentions the coronal plane, then you think of a crown or a corona, and a headband or a crown sits on your head and naturally slices you into a front half and a back half. Transverse or horizontal plane divides the body into upper and lower parts. Terms that we'll use are superior and inferior. Superior being upper part of the body, inferior, of course, lower. Actions within this plane are rotation. One of the ways to help remember this is the word trans means across, like a transit system. So, of course, transverse would be dividing the body in half across. Most real-world movement, however, happens in the oblique plane, which is a combination of the planes that we talked about before. So it combines 2 or 3 cardinal planes, and oblique means something that is not parallel or a right angle, so it is an odd angle. The trick here is O for odd or off angle. And as far as the visual aid, you could think of slicing a baguette or a loaf of bread at a diagonal to make a fancy toast. That slanted cut is an oblique plane. So that would be a good visual when you're taking tests. Remember, for every plane, there is a corresponding axis. So again, we have sagittal, frontal, vertical, and oblique. With the sagittal axis, the direction of the rod, dowel rod, diagram is a great way to show this because it is moving anterior to posterior as if an arrow has been shot straight through you. And the action is lateral flexion of the spine, so that would be moving from left to right. With the pin there, you can only move left to right. It would be more difficult to move front to back. With the frontal axis, it occurs in flexion of the elbow. So that would be in the sagittal plane, but it rotates around a frontal axis. Again, the dowel rod here passing through the joint from side to side, and the direction would be medial to lateral. With the vertical axis, this diagram shows the rod being put through the top of the head down through to the feet. So action here will be rotation, and direction of the axis is superior to inferior. Of course, vertical being up and down. The oblique axis is any axis that passes through a joint at an angle other than 90 degrees to the cardinal planes, and it is a diagonal pin that allows for complex multi-planar movement. Think of a standard screw. If you drive it straight into a board, that is a cardinal axis. But if you drive it in at a wonky diagonal angle, the head of the screw will rotate in a way that moves across multiple directions at once, and that is an oblique axis. Again, O, thinking odd. The action is flexion, abduction, and external rotation of the hip, and direction is medial to lateral. Now, a real-world example of this, of course, is like we show here, the external rotation of the hip, but it can also be used by looking at the foot and ankle. Most people think that the ankle just moves up and down, so dorsiflexion or plantar flexion. However, the subtalar joint where the heel bone meets your ankle bone actually rotates on an oblique axis. And because the pin is diagonal, when you roll your ankle inward or inversion, the foot doesn't just tip, it also points down and turns in slightly. Here we have movements of the body bringing all of this together from the axes, and you will see with the neck there is flexion and extension and lateral flexion and rotation. And along the left side of this diagram, it does show range of motion degrees that you can expect with this. I would pause the video here and take note of these and familiarize yourself with them so that you can understand it a little bit more. Moving on to the spine and thorax, again, here are normal range of motion degrees. When talking about the thorax, it's also important to remember movement with inhalation and exhalation. Inhalation is elevation and expansion, where exhalation is depression and collapse. Here are different degree range of motion with the scapula, showing elevation and depression, protraction and retraction, so abduction and adduction, and upward rotation and downward rotation. Shoulder range of motion degrees, abduction and adduction. Again, remembering abduction is when you are taking it away from the body or abducting it away from the body. Adducting, adding it to the body, bringing it back towards the body. Flexion and extension, ways to help with flexion. Flexion equals folds. The angle of the joint decreases, so essentially you are folding the body part. Extension equals extends. The angle of the joint increases. You are extending it out to its full length. Horizontal abduction and adduction, again, taking away or adding to the body. lateral rotation, moving it away from the body, medial rotation, moving towards the midline. These illustrations are great, showing flexion and extension of the elbow and forearm. Flexion, of course, decreasing that angle again, and extension with the diagram on the right showing an extension of that angle. And supination and pronation, these are great illustrations to show you what that means. Wrist movements and range of motion degrees, flexion and extension, abduction and adduction. Technically, the thumb is the only digit capable of true functional opposition as we define it in human anatomy, but it is important to note that there is a little, no pun intended, exception at the other end of your hand, and that is the pinky, and that is the apposition, and it does help with that, but here we are showing flexion and extension of the thumb and abduction and adduction of the thumb. These rules that we talked about previously with flexion and extension and adduction are shown here with the fingers as well. Mandible movements include depression and elevation, lateral deviation, protraction and retraction, and these are their range of motion. Pelvis movements include lateral tilt or elevation, anterior tilt, downward rotation, and posterior tilt, upward rotation. Hip movements and their range of motion degrees with lateral rotation and medial rotation, flexion and extension, adduction and abduction. Knee range of motion, flexion and extension, medial rotation and lateral rotation, and this is showing the right knee here. Ankle, foot, and toes, you have dorsiflexion and plantar flexion, flexion and extension, inversion, which is supination, and eversion, which is pronation. Moving on to joint classification, we classify joints in two ways: how they move, which is functional, and what they are made of, which is structural. This chart is great at showing those in different ways. This is a great time to pause and overlook this. Functional joints are joints that allow movement: synarthrotic, amphiarthrotic, and diarthrotic. Now, an easy way to remember these as we go forward is a SAD mnemonic. So taking SAD, and the S is stuck. So movement, none. The A would be a little bit. So you have slight or limited movement. And then when you're talking about diarthrotic, the D equals dance, and you have freely movable, able to move about quite a bit. That will help you during test taking and anything else that you need to do when discussing those joint movements. Synarthrotic joints are very little to no movement. The most famous example of this is skull sutures, but there are other ones as well. Amphiarthrotic are limited movement. These examples are the pubic symphysis and intervertebral discs, and etc. Diarthrotic, freely movable. Examples are wrist, elbow, knee, etc. And these are absolutely your action joints. Structural joints include fibrous, cartilaginous, and synovial. Fibrous joints have no synovial cavity. They are bound together by fibrous connective tissue. An example would be tooth roots and sockets. So think F as in fixed or fastened. So think sewing the bones together, that type of thing. Cartilaginous, it lacks synovial cavity and permits little to no movement. The C could stand for cushion. So they would have a C-shaped cushion in the middle. They are connected by hyaline cartilage and also contain a fibrocartilage disc to connect bones. Synovial are built for movement and they have synovial cavities. So S would be slippery, they move easily, or space. They are able to slide and they are filled with synovial fluid, which is like WD-40 for the body. In this diagram, we see where it wants you to build a knee. So there are words listed on the left-hand side, and it wants you to put them with the diagram on the right. I will have a print off in class that we can go over this with. Not all synovial joints move the same way. We have hinge, pivot, ellipsoid, saddle, ball and socket, and gliding. Hinge joints are uniaxial and only move around one axis. They have flexion and extension. An example of this would be elbows, fingers, and ankles. Next, we have pivot, and that allows for rotation. So we have examples of this are the C1 and the C2, the atlantoaxial joint, which allows our neck to pivot around. Ellipsoid joints are biaxial, so that means that they move around two axes within two planes. Movements in multiple directions, so you have flexion, extension, abduction, adduction, and circumduction. The oval-shaped bone connected to the elliptical basin of another. The example of this would be the radiocarpal joint. The saddle joint is biaxial, moves around two axes within two planes, moves in multiple directions, and the example is the thumb. The ball and socket is like the hip, which are triaxial. It offers the most freedom. It moves within three planes. You have flexion, extension, adduction, abduction, rotation, and circumduction. Other examples are the humerus, the femur, etc. Gliding joints are non-axial, so no rotation around an axis. And an example of this would be those tarsals and carpals, so keep those fingers and toes moving. Moving on to joint function, they allow movement. They can limit movement, they bear weight, absorb shock, and provide mobility and stability. What affects mobility of a joint? Shape, design, muscles, and fasciae. Stability of a joint relies on two things: passive restraint, which is the joint capsule, ligaments, and fasciae, and active restraint, muscles and tendons, creates a tensile force. Now we're going to move on to chapter 6, which is part 2 of joints. In a clinical setting, you'll assess active, passive, and resisted range of motion. You'll also need to pay attention to infill, which is the sensation you feel at the end of a joint's movement. Forms of range of motion include active ROM, which is when you are moving it yourself, passive ROM, when someone is helping move it for you, and resisted ROM, when you are resisting or moving the opposite direction of how someone, or like a therapist, is trying to move you. Joint play or accessory movement that occurs at a joint that is not reliant on voluntary control. A perfect example is when you're moving a client's fingers. So when you're massaging, and this is at the interphalangeal joints. There are restrictions to movement, and there are 3 barriers. 1, bony, that's where bone meets bone. 2, tissue limitations, so flesh meets flesh, and that happens in the elbow, knee, etc. And elastic limitation, this is the joint capsule or ligament causes it to stop. Hypermobility versus hypomobility. Hypermobility is excess movements in joints, and you are prone to injuries more for this. Hypomobility, constraints to joint mobility. So muscle strains and pinched nerves are common injuries. Each joint has a characteristic infill, normal and pathologic. This is the sensation that you feel at the end of a joint's movement. Normal infills might be bony, which is a hard stop, or soft tissue approximation, which is muscle hitting muscle. Can also be soft, and that is the elastic tension causing restriction. It's taut muscles. And ligamentous, which are tight ligaments or joint capsule. Pathologic infill tells us something is wrong. For example, a boggy fill indicates swelling, while an empty infill means the patient stops you because the pain is too intense before you even hit a physical limit. But there are different ones here. You have muscle guarding, capsular, boggy, spring block, and empty. Strains and sprains. Strains is an injury to muscle or tendon, and sprains are an injury to ligament. The way to remember this the easiest is the T trick. So, strain, of course, has a T. T for tendon or T for tight muscle. So again, strains, muscle or tendon, T for tendon, T for tight muscle. And sprains, no T, so of course that leaves only ligament. Types of motion includes osteokinematics and arthrokinematics. The easy way to remember here is osteo, of course, for bones. So pathway of bones, normal body actions include extension, flexion, etc. And then arthrokinematics, motion that occurs between articulating surfaces. So A, articulating. Roll, spin, glide, and you have concave and convex roll. Roll, raising arms will cause rolling at the glenohumeral joint. Glide, gliding at joint surface, such as movement at the metacarpophalangeal joints, like picking up a can of soda. Spin, rotation at the joint, such as pronation or supination at the head of the radius, so opening or closing a door by turning the door handle. Ball and socket joints are convex and concave. The convex is the ball end and concave is the socket end. And this shows different examples of what can happen during those motions. Finally, let's look at how joints work in sequence. We have opened and closed kinetic chains. In an open kinetic chain, the distal end of the limb is free, like when you're doing a bicep curl. And in a closed kinetic chain, the distal end is fixed, like during a push-up where your hands stay on the floor. Here it shows a man sitting in a chair, and you can see with an open kinetic chain that the distal end is free to move open. In this diagram, it shows a closed kinetic chain. The man is again sitting in the chair, but he is standing in an upright position, so the distal end remains fixed or closed. We also look at closed packed versus open packed positions. Your knee is the most stable closed packed when fully extended. When it's flexed, it's open packed and more vulnerable to forces like traction, compression, or shear. Forces on joints include traction, compression, shear, bending, and torsion. Traction is pulling from each other at the joint. Compression is pushing towards each other. And shear is the parallel force with each joint going in opposite directions. So one joint going one way and the other going another way. And as the last part of this presentation, we have bending and torsion. Bending, so moving side to side, concave side compresses while convex side undergoes traction, and torsion or rotary force, twisting action along longitudinal axis. And that typically on force rotates while the other is stabilized or turned in the opposite direction. The neck is an example of this. And that is all for today's presentation. Thank you, and I'll see you in class.